Hi, my name is Holly Bassoni-Lutz, and I'm an RN and the Hospice Program Director for Interim Healthcare Hospice in Farmington, Connecticut. A patient education booklet can be downloaded for free at www.lungtalk.org. Use it during the video to follow along and take notes. I would like to talk with you today about the importance of advanced care planning, what it is, and why it is so important to plan ahead. Do you know what healthcare treatments you would or would not want if you could not speak for yourself? Do other people know what your wishes are? Healthcare planning for your future, or advanced care planning, is a shared understanding of what matters most to you, is for people of all ages, lets your family and healthcare team know about your choices and wishes, and lets you remain in control of your care should you become very sick. When surveyed, 6 out of 10 people say that they don't want their family burdened by tough decisions at end of life. The reality is that almost as many people have not made their end-of-life wishes known to the family. The vast majority of people say that if they were seriously ill, they would want to have a conversation with their doctor about end-of-life care. Again, the reality is that very few people ever have this conversation.
When it comes to long-term care and long-range planning, I think it's very important to relieve your family of that burden. These are decisions that you should make, or say you and your spouse. Conferring with your family is fine, but the decision should be yours. Desires are known, they're written down. Some people would be very uncomfortable with that, but it's a fact of life. Literally from the minute we're born, we know what's going to come and prepare for it. Plan. Planning, here again, planning takes a lot of the stress away. It makes your wishes become more paramount. Address it.
When you document your choices and wishes about your future care or advanced care planning, it's called an advance directive. An advance directive is a legal paper. It tells others what you want for your medical care and is used if you become sick and can't speak for yourself. And advance directives have 2 parts, a living will and a durable power of attorney for health care. Think of a living will as a list of instructions regarding your medical care preferences. One part of the advance directive is the living will. Keep in mind, a living will is not the same as a will. A living will is used to help take the burden of stress off of your family by letting them know how you would want to be treated when you can no longer speak, if you cannot make your own healthcare decisions, or are permanently unconscious. This is then given to your attending physician, and it's also important for your family members to know where you keep your living will for an emergency. As I said, a living will is a paper or document. You make it when you are alive and able to speak for yourself. It's used only for healthcare choices, and it's used to tell others what you want for medical care when you can't speak for yourself. A durable power of attorney is another part of an advance directive. A durable power of attorney for health care is a legal paper or document. It names someone to make medical choices for you if you are not able, and it is used for healthcare choices only. It's used when you cannot speak for yourself. When choosing a person to be your durable power of attorney, you may think of a friend or a family member, a priest, a minister, a rabbi, or a lawyer, anyone that you feel comfortable with that will be able to speak for you when the time comes. The right time to talk about advance directives are while you are in good health. Think about what is important to you and share this information with your family and physician. By having this conversation, you are giving your family and friends a gift of knowledge. It is difficult to make these important decisions for someone you love if you do not have a clear understanding of what your loved one would want. By providing this information to your loved one, it allows them to make decisions on your behalf without the burden of guilt about the decisions they make.
The power of attorney and the living wills, and discussed with the attorney having We have 3 children. Having one child be the spokesperson for the rest. This way it takes the doctors, their input is important, but the doctors don't have to make the decision or have the children expressing their differences of opinion to a doctor. So we've chosen one of our children to be the spokesperson.
In order to decide what your preferences may be, certain medical terms need to be explained. CPR, or cardiopulmonary resuscitation, is something that doctors and nurses do to restart your heart by pressing on your chest. If your heart is restarted, you may need what's called mechanical intubation. This is a tube that is inserted in your mouth to take over your breathing if you're unable to breathe for yourself, along with artificial nutrition and hydration, which supplies nutrients and fluids intravenously or by a tube in the stomach when you cannot eat or drink for yourself. When you see someone receive CPR on TV, it usually is non-invasive and almost always successful. In real life, unfortunately, this is not always the case. If your heart stops, do you want CPR? If you can't breathe, do you want to be intubated? And for how long? And if you can't eat or drink, do you want to be fed artificially by a tube or an intravenous? And again, for how long? CPR was meant to treat accident victims or people who are normally healthy. It is much less effective and at times can be harmful for those already suffering from a terminal illness. Once CPR is started, other interventions will be needed. And these interventions are serious. It is important to remember that you cannot have just a little CPR. DNR, or allow natural death, is a decision that you can make for yourself. It is a decision you make to say no to emergency treatment if your heart stops or you stop breathing. DNR, or allow natural death, supports you in your choice to die when nature determines it is your time. It supports your treatments of symptoms for comfort and improved quality of life. And it means that you do continue your treatments for your symptoms. If your heart should stop beating or you should stop breathing, it means that no aggressive interventions will be initiated, such as CPR. CPR, and allow natural death, supports you in your choice to die when nature determines it is your time. It supports you in your decision to die a natural death. Part of having a conversation about advanced directives is to help you become an educated consumer. And in order to do this, you need to have all the information to make choices about your treatment and care. It is important to understand that if you do not desire to have aggressive treatment for terminal illness, that you can focus on living and your quality of life. While all hospice care is palliative, not all palliative care is hospice. Both hospice and palliative care are a philosophy of care that focus on improving quality of life. It's a holistic team approach. It's appropriate for any age and can be received in a variety of settings. Palliative care can be provided at any stage of a serious illness, and it can also be provided along with curative treatment. Hospice care in general is provided in the last 6 months of life. It focuses on care, not cure, and provides bereavement services. Both palliative and hospice care focus on quality of life, comfort, and dignity. It is not about dying, but about living and living your life to the fullest for however long you may have. There are many misconceptions about hospice care, and I would like to talk about just a few today. Myth or fact? Palliative and hospice care is for older people. Well, that's a myth. In fact, palliative and hospice care is for people of all ages with a serious illness. Myth or fact? Hospice means the patient will die soon. I heard you all say myth. In fact, hospice is generally provided in the final 6 months of life and does not mean death is going to happen right away. The earlier a person receives hospice care, the greater chance there is of addressing his or her needs. Since hospice is a team approach with doctors and nurses and spiritual advisors, social workers, home health aides, and volunteers that all address a person holistically, it is important to develop a relationship of trust. The sooner the team is able to be a part of the person's care, the more the team will be able to address the person and family's needs and symptoms of their illness. It has been demonstrated that families that receive hospice care and bereavement support have less risk of prolonged grief than those that do not. Myth or fact? Patients and their families have to pay for hospice. That's a myth. In fact, hospice is covered by Medicare and many private insurances. Hospice is for all terminal illnesses, not just cancer, and it can help to defray the cost of care to the person and family, since it covers all treatments related to the palliation or comfort of the terminal illness. This may include equipment, medication, and all the visits from the care team. It also supports the family for 13 months after the loved one's death. And finally, one last myth or fact. The patient must give up all treatments related to terminal illness, including tube feedings, therapies, wound care, or medications. That's a big myth. In fact, each patient and situation is looked at on a case-by-case basis and discussed with the primary care physician and the hospice team. Each treatment is evaluated based on the benefits versus the burden for that patient. Each situation brings unique circumstances that need to be discussed.
You know, just because you have a will or you make these directives doesn't mean that you're dying tomorrow. I guarantee you, taxes, you're going to pay taxes, and you're going to move on at some point. So plan on it.
By working together with patients and the healthcare team, the hospice team can help avoid unnecessary hospitalizations, offer ongoing comfort and support to the patient and family, and offer ongoing help to families after the loss of their loved one. Talk with your family, friends, and physician about your advance directives. Be sure the person you select to make these decisions for you understands your wishes. You need to trust this person to have your interests at hand. This person must be willing to accept the responsibility of making healthcare decisions for you if you cannot speak for yourself. It also tells your healthcare providers what treatments you would or would not want if you are unable to tell them yourself. For more information on the Lung Talk videos, please visit our website at www.lungtalk.org or email us at lungtalk@qualidyn.org. Thank you.